Our next speaker is an incredible pioneer in healthcare. Ponce Course is one of the leading one of the largest Catholic hospital chain in the world, if not in the United States. And Samir drives transformation there and brings, as chief data officer, is transforming the hospital. And Samir joins our rank of customers, and we're super excited to have him speak about the challenges and opportunities in transformation for healthcare, especially given post-COVID.
Thanks, Sri, for the introduction. And just wanted to point out we're partners in this, definitely not customers by any means. I think you and your team have been super instrumental in making us feel that way and setting us up for success. Give me a second while I share my screen. Sri, can you see my screen?
Yeah, thanks.
All right. So when we look at the potential of deploying AI in healthcare and the impact it can drive, the opportunity in our mind today are endless. We at Bon Secours and I think healthcare in general are very ripe in this space, and we see opportunities to leverage AI and drive impact through our care continuum. I mean, it's just the opportunities is immense. What is encouraging is that this sentiment is shared across the healthcare IT sector, and organizations both small and large are doing something about it. Whether it be startups where we see a lot of movement and tech giants who are actually doing quite a bit of work now, investing in IT, in healthcare IT technology, investing in AI, and also investing in apps. There's a substantial amount of energy investment that is going into space, as I said, and we are starting to see that resonate both in the public and private sector. There's, as you can see on the screen here, there are quotes and things that are issued in the public domain today that shows that AI is here to stay. So we at BSMH have made this a priority and have made a commitment to embed AI in different ways into the way we work, and also make it a priority and key area for our growth. While we are encouraged by the potential of AI, considering our mission and the nonprofit posture that we have in place, we put a lot of emphasis to make sure that these programs and projects are set up for success. When we look at the bag of, for lack of a better term, AI failures, both internal to us and things that have happened in industry, we realize that for AI projects to be successful, there has to be a bit of reshuffling around what happens and how much effort and investment goes into what part of these initiatives and projects. While we realize that data and data science is really important to an AI project, more focus needs to be paid, attention needs to be paid to the user and the adoption of these capabilities. We have therefore pivoted quite a bit in focusing on the, as you can tell from the screen here, to the UI UX element and the adoption of AI capability into the workflow, because I feel that's where, in our mind, that's where the missing link is. That's where, when we open up that bag of AI failures, we start to see trends that show us that the models were great, but they were not deployed, and they weren't deployed because they weren't accepted by the business, and they weren't accepted by the business because they didn't have ways and means of fitting that into the workflow. And I think that is where apps actually come in. and building of apps around these AI capabilities actually come in. In addition to that, and we'll go to what we're doing about those apps in my last slide. We also adopted a very methodical and prescriptive approach to AI projects. This allows us to make sure that the prioritized and high-level use cases make it into the build sheet, which is really important. We felt at times that that was not a focal point. People saw a good idea and exciting thing for us builders to build and just ran with it. So we wanted to make sure that we follow the process which will allow us to think through the problem, make sure this is a problem we are trying to solve, make sure that there's agile built into how we build these projects, which the missing piece that we saw was collecting feedback as these projects get built and having a way to actually pivot around and navigate around the changes in the ask or things that we didn't understand. And then finally focusing on the consumer at the end of how, as I mentioned, this solution will fit into the workflow and benefit the workflow. In our case, benefit the patients and the caregivers. So, and that's where I think, apps come in again. It's a way for us to bring it to the masses, to ingrain the AI capability into the folks that need it most. So we at BSMH have partnered with H2O to develop our AI muscle, which includes developing the apps, which includes developing the models, and finally handing it to the people that matter the most, which is our patients and our caregivers. We have a variety of clinical and non-clinical use cases that have potential to deliver impact, which is in the form of improving outcomes and patient lives in the communities we serve. So this is a really important area for us. We do this today. We just want to do it in a different fashion now, leveraging AI and leveraging technology that exists today. H2O will not only bring us the platform where we will do our data science, but it will also help us democratize our AI capabilities through these building of apps and the app stores and a few other features that she talked about today. We at BSMH are truly excited about this opportunity. I think this is a game changer for us. We believe that the H2O team, their capabilities, their platforms, and their, I think, way of thinking through data science and an AI problem will improve our speed to market, which will allow in turn to start to deliver impact in a meaningful and efficient manner. In closing, I think what's important to recognize here is that we as folks that have been managing data and working in models have been doing this for a while, and I think we've done a good job putting things together. What we haven't done a good job in putting it into the hands of the consumer. And that's where I think this conversation, when this was brought to me, I personally was very excited to talk about this, is because I feel it's time for us to shine. It's time for us to take this capability and the amazing work that we have done in the last 20, 25 years and take it to the masses and make it meaningful and make it count. So people can say that AI is actually something which they use day in and day out, which at times I think they're starting to realize through other means, but at least in healthcare, it's not as transparent and prevalent. I'll pause there for some reactions or questions you guys may have.